What would you like me to do?
If you find
Okay, I'm good with that. So my job essentially is to work in the community to assist seniors to be as safe and happy as they can in the setting that they choose to live in. So most people want to stay at home. Most people want to be able to grow and change in their own home. And so we as a community are trying on a continuous basis to help individuals to become what they want to be, where they want to be. Now, there are times that individuals may have to move to a larger care facility where they could get more care dependent on their situation. But my philosophy is always freedom over safety. So you may, if you think back to if you have children, when you gave your kids the car keys for the first time, it scared you to death and you wanted to just say, no, you're not going to get this. But you had to give them the ability to grow as a person and to be, even though they were in more danger than they were previously, they were able to grow and become a better person because of the experience that you had. So as you grow older, having the choices taken away from you and having somebody tell you what to do or where to be is, it's not letting an adult be an adult. And so my job is to assist individuals to be as safe and as self-actualized as they prefer to be. So I work with the city of Kettering. Kettering has an extremely large population of people over 65. And so we have received a grant from Housing and Urban Development for what's called a service coordination position. That is my position. And so I work with every division in the city to ensure that the city is user-friendly for an individual. But I also run a place called the Kettering Connection in Town and Country Shopping Center. And that is for anybody from Montgomery or Greene County. We have people come from up near Columbus. We have people come from down in Springboro and Middletown. And what they can do at this particular center, it's an education center. You come in, you make an appointment, and at that appointment, we talk to you about what your goals are, about what your resources are, about what you want to see happen with your care. And I then compare your wants and your interests with the programs that are available in your area. And I assist you to set up a plan in which you can plan your future, whether it be to move to a retirement community where somebody takes care of everything, or whether it is to stay at home and arrange for services to come to you in the home. So that's what the service coordination does. I do assessments for individuals. Now there are times that we have individuals who have dementia or they have some process that doesn't allow them to make good decisions for themselves. And so what I do is then assist them in, helping them understand what it is that they need, how to go about getting it. And then sometimes my job is to say, I don't recommend this for you, but you have choice. You have the ability to make decisions, to choose the things that you're going to have in your life. And so then I just have to, this is what I think, but you're more than willing to be able to do whatever you want. So I work with the police and fire department on what we call frequent flyers. Those are individuals who call 911 on a daily basis to perform tasks that they could have someone else doing, but they just don't know how to get those services and how to get those things into their home. So the police or fire department would refer them to me and say, we've met with this person. They call 911 a lot and they seem to need services, but they don't know where to go. And so I will go to their home. I will meet with them. I will help them to understand what's available. And sometimes there are individuals who don't qualify for any programs because they have significant assets. And a lot of times those individuals don't want to use those assets. That's how they got them. And so my job is to help them understand that they really do need to provide for their care, because 911 is not an appropriate use of city funds.
It's not a concierge service.
Yeah, it's not a concierge service. So that's kind of what I do. Also work with our Latham Senior Center. That's on there as well. The Latham Senior Center is the largest senior center in Ohio. We have over 10,000 members, and it is part of the recreation complex on Glengarry Drive. We have a transportation program that runs Monday through Friday that can transport an individual to anywhere they want to go. A lot of senior transportation programs will take you to a doctor's appointment or to a medical appointment only. We provide services for anything. If you want to go get your hair done, which is a religious experience for most women who are older, they have always gotten their hair done. So we will take you there, we'll take you to the bank, we'll take you to your lawyer or wherever you would like to go. We have group trips, so we go to one grocery store every day. So if you call us and say, I want to go to the grocery store, we go to the Kroger on Dorothy Lane, the Kroger on Stroop Road, Meyer. We go to the Walmart that is actually in Moraine off of Dorothy Lane. And then we also go to the Walmart that is in Bellbrook on Wilmington Pike. We also go to Dots and some other services. So we allow an individual a certain amount of time to shop, and then we take them home and help them get their groceries back into the home. So we also have, with our senior transportation program, you do have to be a Kettering resident, and you do have to be over 60 years of age. The reason you have to be over 60 years of age is that is funded through the Older Americans Act. Most senior transportation programs are, and the Older Americans Act funding is for individuals 60 and over. So a lot of people think it's 65, but in Ohio and with the federal government, 60 is considered to be a senior. So anyone over the age of 60. Now we do sometimes make allowances for individuals who have a disability who are younger than 60, but we do that on a case-by-case basis. We will also help them to work with Project Mobility, and if they have individuals who would actually be able to use RTA, but they're just not able to. They've never used the bus system. They don't know how to plan a trip. So we will hook them up with RTA's ride education individual. So that person would teach them how to set a bus schedule, how to use public transportation, those kind of things.
Can I ask a question? On these trips, is that a bus that you guys own and you have a driver hired to run around and do this, or is it people using their own vehicles?
No, it is our vehicles. We have 2 handicap accessible vans, the minivans. We do have the larger buses, but those get like 6 or 7 miles to the gallon, so they're not real efficient for using every day. So we use the smaller transports that are handicap accessible, and then we also have cars. So the police department on a regular basis phases cars in and out of the system that our detectives use.
Okay.
And so some of those cars that still are in good working order but not really something that they're going to be able to continue to use with the police department, then those would be donated to the senior center. We do have volunteer drivers, and then we had paid drivers. The paid drivers use the larger transport buses. You do have to have a CDL for those. Right. So we do that way.
Thompson, I think there's a lot of parallel here.
Yeah.
Well, yes, I
So where do you work?
Choices in community living.
Oh, okay.
So we do a lot of transportation, and we
Sir,
have a partner.
I apologize. What was the third salad that you wanted on with your trio?
Potato salad.
That's what I thought. Okay.
Yeah, so we can provide the services for individuals as long as they live within the Kettering area.
Honestly, I didn't know that.
And then we don't discriminate. So if you qualify for Project Mobility, but you prefer to ride with us, we don't say, some organizations say, well, if you qualify for Project Mobility, you have to use that. We allow individuals who qualify for other transportation. I do have individuals who they actually don't like driving in the snow and in the wintertime, so they will get our transportation to take them through the winter, and then they go back to driving when spring comes, and they don't have to feel like they're driving on ice or anything like that. Now, our transportation will not run if Kettering has a snow day. We will not run our transportation because if they have a snow day,
school system.
Yeah. Usually because now what we will do is if they're on a 2-hour delay, we will continue our schedule or if they're on a 2-hour delay and then they close, but we've already started we will continue what we do. So all of our drivers are trained to help individuals with disabilities to get in and out of transportation. And we have actually been very successful using the smaller vehicles, which when we first went to that, I thought, I'm not sure how that's going to work with some of the bigger scooters and those kind of things. But we've really not had much of a problem at all because they don't have that middle seat.
Is this the one where the ramp just kind of flips out?
Yeah. The only problem I found when I actually drove one is you have to be very careful with railroad tracks.
And speed bumps.
Speed bumps, yes.
They're very heavy.
They are very heavy.
They cut the floor out
Yeah.
a little bit lower in those vehicles, so the clearance is only about
short.
Yeah, it's very, very low. I found that out going to the VA once.
Get in and out easier.
Oh, absolutely.
Yeah. I found that out driving someone to the VA. So we transport anywhere inside of Kettering. We transport a limited area outside of Kettering. And we take our veterans into the VA because a lot of them don't have the ability to get a doctor in the city. So we would take our veterans to the VA as well. If you turn the page, there's a little about the Kettering Connection. The Kettering Connection started as a cooperation between the City of Kettering, Senior Resource Connection, and the Town and Country Mall. So they had a shop that was smaller and they didn't use it, and they were having a hard time getting anybody interested in the spot. So we took that spot and they allowed us to move in there rent free, and we were able to utilize the spot by just paying the utilities for it. You can come into that space. You can as a caregiver, you can as an organization, you can as a senior yourselves. You can come in, sit down with our staff, and that's usually me, and we talk to you about the kind of things you're looking for. A lot of times people don't know what they're looking for. They just come in with a lot of information, or, I just need information, and we help them with that. We provide utility assistance there, applications. We do applications for Medicare, Medicaid. We do applications for assistance with prescriptions, applications for any kind of public service agency. We utilize the Ohio Benefits Bank. So we enter your information and the computer literally tells us every state, federal, and county program in your area that you're eligible for. And it will then take the information we gather, it will drop it down into all of the applications. Some of the applications get emailed through the system, others have to be printed out and mailed, because you do have to send, for example, utility assistance. You have to send a copy of your utility bill, you have to send a copy of your income, those kind of things. So also this is just for City of Kettering, we have home improvement grants and loans. We provide a $5,000 grant for individuals who need to handicap access their home. That may be a ramp to get in and out of the home. That may be widening doorways for a wheelchair or a scooter that is larger than the normal chair. And then we also can do lower cabinets for individuals in wheelchairs who need a cabinet surface who's a little bit lower. So that's free of charge. You do have to income qualify because that is through a state program. And then we also offer loans for individuals who are lower income who may have a crisis. So example, January 2nd and your furnace goes out and you don't have the funds to put in a new furnace. So we can do an emergency loan to help you get a furnace put in. It's a 0 interest loan, and that loan does not have to be paid off until you either sell the property or it goes through your estate. So it works very much like a reverse mortgage, except you would get that through the city.
Wow.
So we work with individuals on those. We have safety programs. We do smoke detector battery changes. When we roll the clock forward or roll the clock back, our fire department will literally go into your home with their ladders if you need a larger ladder, and they will change all the batteries in your smoke detectors for you, make sure that they're operational. If you have non-operational smoke detectors, the Red Cross does free installation of smoke detectors, and they're free of charge. They do the installation free and the smoke detectors free. So we would refer them to that source to get new smoke detectors as well. And we also administer, we have a grant where we provide you with a carbon monoxide detector as well. We do fire programs. We do CPR for seniors that we teach them CPR where they don't have to crawl around on the ground, because a lot of seniors don't want to do that to learn CPR. They may have to do that to do CPR, but they just are not able to do that very well. So we work with individuals and help them.
You teach classes on?
Yes. Actually, John Moore is one of our firefighters who was injured in the storm in 2008. He had a tree that fell on him, so he is now in a wheelchair himself. But he teaches the accessible, the CPR class from his wheelchair. So he helps people understand that you do not have to just close up your life if something happens to you. He's a great example for individuals.
Is there a fee for that?
No, that's all free.
And that's all City of Kettering residents?
No, you can, individuals who live outside of the city of Kettering can come. I think it's like a $10 fee for individuals to do that. Sometimes we do it through the senior center where there's no, a lot of the people who go to our senior center are not Kettering residents. But if you are a member of our senior center, you're considered to be a Kettering resident when it comes to our programs. With the exception, we don't transport the people outside of our area.
Could anybody join your senior
Anybody
center?
can join the senior center. Because of its location near the green, we're actually have a lot of people from Beaver Creek, Greene County who are members of our senior center. We're one of the only senior centers that actually has a pool for exercise programs.
It's been here forever.
Yeah, and then we actually have handicap accessible apparatus that takes you in and out of the pool for individuals who are in wheelchairs who can get in and out of the pool. They can get in and out of our whirlpool as well using the lifts.
One thing you might want to check on. I've done vision screening at senior centers, like at Springfield and so forth. I'm amazed how many seniors come in, need their eyes checked by a doctor who aren't aware that Medicare provides a free eye exam, and they don't know that.
Yeah, we actually have the vouchers through Prevent Blindness as well.
Yeah, I'm on the board there.
We do, so they will come in and if they have a prescription, I will work with Prevent Blindness to get them their glasses, or if they don't have prescription coverage or have coverage, or they have that copay for Medicare, I can help them get into PBO's program.
Okay.
So we do have that at the Kettering Connection as well.
If you want to have a health fair, I'd be happy to do vision screening.
Okay. I'd be happy to do that. I actually was supposed to do the training that was back a couple of months ago, and my daughter was very ill in the hospital, so I didn't get to go to the training for the screening.
I'm certified to teach it.
Okay, well, I'll have to hang out with you then.
Okay.
Some of our other services, we provide an AARP driver safety course. If an individual over the age of 60 gets into that course, they can get a reduction on their driver's insurance with that certificate. We do personal safety courses. We actually offer a program called RAD through our police department, where you actually get to practice beating up on a police officer, which is always very cathartic for some. I did the class right after I got a ticket, so it was very cathartic. So I'm like, can I request the officer that I get to? So we put them in suits, and literally they come after you, and you have to try to defend yourself. So it's a really good program.
You requested your officer.
I did. I said, can I have Jeff? And they're like, no, he's a road guy. And I'm like, no, really. And so he did come in and put the suit on. He was a good sport. So we always have a good time. So we also do police welfare checks for individuals. Families call us and say, hey, here's the situation. My family member, I've not heard from them. Can you go and check on them? And our police will go. Sometimes we have found that somebody has died.
Yeah.
Sometimes we find from a neighbor that they went on vacation and just didn't tell their kids or whatever, which is how I plan on vacationing for the rest of my life. Then we have a program through our police department that happened because we have an individual who had dementia, who drove away from home and ended up killing himself and someone else in an accident.
Wow.
So, and when they put in the actual, it took a while when they made the report. The officer had to get all the information, had to get a picture, and thank you. They had to get a picture of the individual, take it back to the police department. So in the time it took to do that, an officer saw this individual, but when they finally went back to find him, he had gone, and he made it down to Hamilton County and had a head-on collision with someone. So the officer that worked that case was so distraught that he started thinking of ways that we could prevent this from happening again. So we came up with our Safe Senior program. He worked with myself and the Alzheimer's Association. Thank you. How our program works is the police department, we come out, we do an assessment. We determine whether or not you belong in the program. We get all of your information, your doctors, your medicines, what hospital you want to go to, your family contacts, what kind of car you drive with the license plate, do you have guns in your home, do you have pets in your home. We have all of this information that attaches to your 911 screen. So when your family, it also has a digital picture. When your family reports you lost, we don't have to go and get all your information and take an hour and a half to do that. We can immediately get all your information out with a digital picture to every police department, and we have been able to save 12 people who have walked away from home or driven away from home who were confused and should not have been.
You find them faster.
Yes,
Yeah.
because we have, and so we also provide a lockbox for individuals with disabilities who live by themselves, who may not be able to get up and answer the door in an emergency, because when we break down your door, we take down your door. I mean, it is really a battering ram.
Yeah.
And so we provide the lockbox, we hide it outside. The only person that knows the information is, it's in a sealed, the code is in a sealed document in the dispatch. The only way they're allowed to seal it is if you call for assistance. And then we unseal the code, give the code to the officer, and the officer gets the key out and gets into the home. And then if the officer needs to do something else, then we already have that information as well. Then after that happens, to prevent anybody from having access to the code is changed on the lockbox, and it's resealed so it wouldn't be able to be
Right.
used until it was needed again.
Right.
So that is one of the free programs that we offer as well. We are actually working with lots of other jurisdictions. We're working currently with Englewood, with Miamisburg, with Washington Township. We're working with the Montgomery County Sheriff's Department to integrate this Montgomery County wide. The possibility of you climbing in on an RTA bus in Kettering and making it to Englewood is pretty high. So we want to make sure that every surrounding community has access to this. We
Right.
provide you with the information. We provide you with grant assistance to pay for the program. We help you do all of that free of charge because we want to make sure that other communities have the same ability to take care of their citizens as well. And then Medicare and Medicaid counseling. We do a lot of that. Medicare is one of the most complex systems in the federal government, and it's very confusing. So I assist individuals each year during their Medicare open enrollment or when they become newly enrolled in Medicare. I help them navigate all the different options that they have, help them find drug plans, assist them with Medicaid applications if they qualify for those. We do all that counseling there in our office as well. We have a senior trash service, which we provide low-income discounts for senior citizens who are in Kettering. And then all of our contact information is right there as well.
So you're the senior service coordinator?
Yes, I coordinate that service. So, any questions?
Amazing.
We
It's
have been very
awesome
lucky.
program.
We have the great support of our city council, our mayor, our city manager's office. They're all wonderful. Our police and fire department offer all the assistance that I need to be able to assist any client that we come across.
You know, it almost makes you want to move to Kettering just to get the services.
That's true. We have a lot of people doing that.
I'm serious.
Our low-income housing, we actually have more low-income housing than any other city other than Dayton. We have 5 complexes, which is pretty good for a small community. And there's a 2-year waiting list for most of those public housing complexes in Kettering. So we have been very lucky to have the support of family and of our residents as well as our council.